Hello everyone, my name is Ambry Papashotker, and this video is an assignment for PBH 300, which is pre-capstone in public health. And in this video I will be reflecting on some research and personal thoughts about a potential career option, which is a social worker. So to begin, what is social work? You may not be familiar with this term, or maybe you think that all social workers work in child protective services, so CPS, child welfare, but social work is actually an incredibly broad field. Here we have two definitions from the information page of UNLV's Master of Social Work, MSW program, and also a global definition from the British Columbia Association of Social Workers. And as we can see, social work is about serving and empowering some of the most vulnerable members of our communities. And right away we can see how that intersects and overlaps with public health. Social workers can work with individuals or families or groups in terms of therapy settings. So when you think of a therapist, a lot of therapists are actually licensed clinical social workers, and they have a lot of specialized training as well beyond an MSW degree or maybe a higher degree. But social workers can actually work in community organizing or policy advocacy, so there's a lot of different roles that you might see social workers in. And here to provide an example of how social work can interact with public health, I wanted to provide an example of a UNLV faculty member who is Jose Luis Melendrez. You might have had his class PBH 200, which is Multicultural Health. So Mr. Melendrez got his MSW from the University of Michigan at Ann Arbor, specializing in community organizing, and he obviously works in a lot of coalitions here in Las Vegas and advocates for the health of minority groups. So definitely a lot of exciting work going on with public health and social work and working together. And to go into some of the education required to become a social worker, you can go in at multiple levels. So you can get your undergraduate degree, which is a Bachelor of Social Work, and then you can be a licensed social work at that level. But you can kind of work in the social work field, but you can't call yourself a social worker if you have a related degree. Getting this information from the Nevada State Board of Social Workers, the term social worker is actually a protected term, so you have to pass a licensing exam. They have their own code of ethics and standards. So, for example, I could graduate with my Bachelor's of Science in Public Health and go and work in child welfare, doing the same job as someone who has their BSW, but I technically couldn't call myself a social worker. And then, as well, beyond the undergraduate level, you can also get a master's degree, so your MSW, and then you can pass a licensing exam as well and call yourself a social worker. Likewise for the higher levels. So if you've heard of Dr. Brene Brown, she has a special on Netflix called Call to Courage. She's written a lot of best-selling books, and she has some very popular TED Talks as well. So Dr. Brene Brown has her PhD in social work as well. So there's also researchers and people who work in academics at the higher levels who have their PhDs in social work. And also, as I referred to, there's the LCSW option, which is like a therapist, the licensed clinical social worker. And here we have some possible compensation ranges. These data points are from the Bureau of Labor Statistics in 3 different areas of social work. So here we have mental and substance abuse social workers, so working with people recovering from substance use disorder, whether that's in inpatient settings or outpatient settings, providing one-on-one therapy or maybe even family therapy if one of the family members has experienced substance use disorder. And then there's healthcare social workers. If you have ever been discharged from the hospital, you've ever been in the hospital, you may have interacted with a healthcare social worker. They may perform roles that are similar to like discharge planners, so someone who may have a nursing degree working in that sort of role. And as we can see here, the healthcare and medical social workers tend to be at the higher ends of the compensation ranges. And then also we have child, family, and school social workers. So there are social workers who work in public school settings, for example, and also social workers who work with children and families, so like child welfare, parenting education, family therapy, things like that, maybe referrals from child welfare services, and that would be at the lower end of the compensation ranges, with mental health and substance abuse social workers being about mid-range. But as we can see here, these are kind of lower paying jobs, and especially for a position that requires higher education. A lot of the time, if you want upward mobility in the social work field, you do need to have at least your MSW. So as we can see here, definitely not as much compensation. That's how it is. And here we have some challenges and rewards of the profession. So to get this information, I did some online research on like messaging boards and such, but I also spoke to two people who do have social work degrees. So one being a childhood friend who does have her LCSW and works in sexual and domestic violence as a therapist. And then another one being an individual who got her MSW from the University of Nevada, Reno, but had a generalist curriculum, so not specializing at trying to become a therapist. So this is the information I got from them. We have a longer graduate school for the MSW, at least looking at UNLV's program, 63 credits, and then if you want to become a therapist, and personally that is what I'm most interested in, so that is why I provided that information here, an additional 3,000 supervised hours, and that's after you complete your MSW, so quite a bit of training. And then relatively low pay, as we saw on the previous slide where we discussed compensation. And then the people I spoke to and seeing online, there is a higher turnover and burnout in this profession, especially when you're working with individuals who have been traumatized. There's a condition known as secondary trauma. So unless you're really on top of your self-care and you have a supportive work environment, you were going to see high turnover and burnout. And then your licensing requirements can vary from state to state. So looking at the job listings and such, a lot of them require people to be a licensed social worker. But if you move states, say if I moved from Nevada back to Virginia, which is where I grew up, I would have to take a licensing exam again, and yes, it can vary from state to state, but the rewards, of course, being empowering and uplifting the most marginalized members of our society, and this field really aligning with my personal and professional values, and then also having the option to switch to a different specialty within social work if you do decide to become a social worker. So, you can work in sexual and domestic violence, or child welfare, or veterans affairs, or working on homelessness, or policy advocacy. There's just so many different paths that you can take. So even if you do experience burnout or an unsupportive work environment, you will always have other options. And this is an extreme example and very sad, but the case of Gabriel Fernandez kind of demonstrating the high caseloads that social workers can work under, and that putting some of our most vulnerable members of society at risk. So definitely, viewer, beware. If you haven't heard of this case and you are interested in finding out more, just be aware. It's a really sad story. And then here again, as I alluded to, the Master's in Social Work versus the MPH program. I'm looking for myself personally, 45 credit program versus a 63 credit program, definitely something to consider in terms of how much time and money will this education cost me. All right, and finally some reflections. Personally, I do still, in my heart, kind of want to become a social worker. I'm very much attracted to the idea of becoming a therapist, like I said, aligning with my personal and professional values, but I want to go bigger. I would love to work with people one-on-one, but in terms of systematic change that we know needs to happen in order to have a healthier and more sustainable society and planet, I don't think social work is for me. And again, here are the core values of social work. If this is a career that interests you, then I would definitely suggest checking out more. It's an incredible field. And that's all I have. Thank you all. Here are my references. Bye.